This is definitely one to reply to with a reel, because this is the $1,000,000 question. If you have a locked knee for buckhandle meniscus tear, then that can really change the decision making and the algorithm. That meniscus tear needs to be dealt with, particularly if you cannot extend a knee. And so in that situation, there are two options. Some surgeons will repair the meniscus, debride it, deal with the meniscus tear, rehab from that, get you recovered, full range of motion back, walking normally again, and 3 or 4 months later go back and do the ACL. My preference, wherever I can, is to try and go in as soon as I can, maybe after a week or two, if I've got availability, and to deal with the meniscus tear and to the ACL at the same time. My rationale is one operation, one hit, one recovery, and you get over it. But this definitely does carry a higher risk of stiffness afterwards, and I've once had to take a patient back to theatre to bend their knee because I did a buckhandle meniscus straight away, repaired it, and they did the ACL and they were stiff. So the risk of stiffness is high. It's a balance. That's why it's a discussion between you and your surgeon and physio. The challenge with doing it all at once is that meniscus rehab needs to be slower, reduce bend, reduce weight bearing to allow optimal healing with the meniscus repair, versus ACL rehab that ideally needs to be more aggressive, getting that range of motion, normal gait back as soon as possible. So you get these competing rehab tensions for the best outcome, and hence we might stage it and deal with the urgent thing that can't wait, the meniscus first, and then do the ACL electively like you normally would, as I explained in the Saturday shortlist last week, and the meniscus is fully healed and the knee and body are recovered. Generally speaking, if you have a buckhandle meniscus tear and you're super stiff and swollen, we might do 2 surgeries for the best outcome, but if it's not terrible, my preference is 1 and done. We know that meniscus repairs overwhelmingly heal best when done at the same time as an ACL reconstruction, and an intact meniscus protects the ACL reconstruction and vice versa. Plus, it's always nice to go back in and admire your fully healed meniscus repair.